lower limb muscles. So we're going to put gastroc and soleus into the same session here today. So gastroc is a biaxial muscle. It's covering two joints. It's covering the knee joint and the ankle joint. Originates from the posterior femoral condyles, both the lateral and the medial one. Will come down and attach into the Achilles tendon, roughly about here at that musculotendinous junction, down into the calcaneus via the Achilles. Soleus is much deeper, doesn't cross over the knee, so it sits but it's much wider, just underneath gastroc, and will come down and again attach into the Achilles tendon, but again much lower down. So it's a much wider, broader muscle as the soleus. But what it doesn't do is anything at the knee joint, unlike gastroc. So let's have a look at gastroc first. So if you want to shovel down towards me, please. Keep going, keep going. That's it, perfect. So for gastroc, you want the client's foot off the edge of the bed, because essentially you're going to bring them into dorsiflexion. So you want them in a position that's not too uncomfortable. So we know that the insertion point is at the Achilles here, and the origin is up on the posterior femur. Depends on what you want to penetrate. If you just want to look at the muscle tissue itself, you might start your release technique at the MTJ of the gastroc, which is around about here. But you also might want to look at Achilles as well. Maybe we've got a little bit of Achilles tendinopathy. So in that case, you definitely want to have a look through Achilles. But let's do the muscle one. So let's start at the MTJ. So you've got two heads to your gastroc. You've got a lateral head and a medial head. So again, you have a choice. You can come in with a broad block to look at both heads, or you can come in with a much more of a shorter block, and maybe again with a fist or thumbs, whatever your choice is, to try and look at each different head itself. So let's do lateral head as it's closest to the camera for you. So you're going to bring the client's foot into plantar flexion, because that's what it does. So here I'm just going to use my thumb, so nice short lock. So I can do different segments then of that lateral head of gastroc. So foot into plantar flexion, and then I'm going to take the foot into dorsiflexion. Here I'm going to just use my leg, just to give you that little bit of extra push. So I'm moving up. Here I'm just doing a nice superficial block, because obviously the gastroc is superficial. If I was doing soleus, I would use a deep block. But I can maybe come in and choose to do a bit of a broader block to get a hold of that lateral head of gastroc and then move up. And again, don't forget you've got the option coming in and using that forearm and just getting with both heads and really getting into gastroc itself. To get into soleus then, you're going to relax the leg. Bring your leg up, your own leg. So you've just got better control that way as opposed to using some kind of bolster. So now with soleus, the same principles apply, but because the knee's in flexion, you've eliminated gastroc to the best of your ability. So really got to target into soleus. Depending upon your anatomy knowledge and your muscular knowledge, you should know that you've got tibialis posterior, flexor digitorum and flexor hallucis longus as well, travelling at the back, and they can travel through medially, so just along the line of the medial malleolus down onto the plantar surface. The foot varies, obviously insertion points there. So in this position you can also penetrate those as well if that's what you require to do. But we're going to have a look at soleus. So we know it's a wide muscle, so we're going to use a broad technique. However, we're going to also use a deep deep block, because it's a deep muscle. So a 45-degree angle towards the origin on the top of the fib and tibia. So you can, the attachment point onto the Achilles is quite low, it's quite distal, so you can start there. You can come over the Achilles if you wanted to, or you can maybe start on the side here. So what we're going to do is take the client into plantar flexion first with the foot, so you're shortening through the muscle. I'm actually going to use my little bit of my elbow here, and then you're going to bring the foot into dorsiflexion. So remember, this is now a deep fascial block because it's a deep muscle. So 45 degrees up with quite a certain degree of pressure to really get in there. So using and working your way up towards the top of the femur, to the knee basically. If you wanted, this is a great position to do Achilles, if I'm honest. I always do Achilles in here. So again, you can use a short block here. Achilles is a superficial tendon. There's one very prone to some kind of anosis, a problem, a degenerative problem. So again, put the foot into plantar flexion and take it into dorsal with your block. Still angling up towards the Achilles origin, which is one there of gastroc, so you can maybe work up there. But this is a lovely technique if you just want to get into Achilles on its own and just stretch it out. Tenosynovitis, so inflammation of the tendon sheath, which is a form of tendinopathy. This is brilliant for.